Hi, everybody. Welcome to the GeoInnovation Speaker Series. I'm Enbal Shacham. I'm a professor at the St. Louis University College for Public Health and Social Justice, where I'm also the Associate Director of the Geospatial Institute. And today I have my pleasure to serve as the moderator of today's discussion. This is the third event in the series, and at this time we're excited to be talking about the intersection of geospatial science, technology, and research, and healthcare. So as a quick reminder, the GeoInnovation National Speaker Series is a collaboration between Innovation Hubs, Cortex, and T-Rex and GeoFutures, an initiative of the recently formed Regional Economic Development Organization, Greater St. Louis, Inc., that was launched October 2019 to bolster the St. Louis region's rapid spatial sector and develop a strategic plan for the future. We're going to start off today with a quick video. I hope you guys were touched by that. So it's my great pleasure to introduce my great colleagues here. So first I'll start with Dr. Alex Garza. He joined SSM Health in September 2016 and recently been appointed as the Chief Community Health Officer for SSM Health, where he works and focuses on the social determinants of health, equity, and social justice with local, regional, and national organizations advocating to improve the lives of the community, leading to healthier outcomes for all. He is currently also serving as the task force commander of the St. Louis Metropolitan Pandemic Task Force, which is comprised of the major healthcare providers in the St. Louis metropolitan area, together joined to combat COVID-19 for our region. Dr. Garza in academia prior to SSM Health at St. Louis University, where he served as the Associate Dean for Public Health Practice and Associate Professor for Epidemiology and in Emergency Medicine. But even before that, he served as the Assistant Secretary for Health Affairs and Chief Medical Officer for the U.S. Department of Homeland Security from 2009 to 2013. In this position, Dr. Garza was the medical authority for DHS and Chief Medical Advisor to the Secretary of DHS as well as FEMA. Dr. Garza led the health and security efforts for DHS, including health aspects of terrorism and natural disasters, including the H1N1 pandemic and the Haitian earthquake and Fukushima nuclear disaster, We're lucky to have him serve in the St. Louis region with an eye toward national global security. And now I'm so excited to also introduce Dr. Este Geraghty. Dr. Geraghty is the Chief Medical Officer at Esri, which is the developer of the world's most powerful mapping analytics platform at Esri. At Esri, she continues to lead the promotion and use of geospatial technology to help solve our grand challenges, particularly around health. Este is the lead of business development in health and human services that reaches many communities throughout the world and guiding decision makers on the best geospatial health decisions they can make. Dr. Geraghty is passionate about delivering value through a geographic approach. Formerly, she was a deputy director with the California Department of Public Health. She led the state's Open Data Initiative. She also did her time in academia, where she served as an associate professor at the University of California, Davis, conducting research on geographic approaches to health policy and community development. In addition to degrees in medicine, medical informatics, and public health, Dr. Geraghty is also a certified geographic information systems professional. We are so thankful for your time today, and we look forward to this discussion. I think to kick off our conversation, I would just like us to reflect on where we've been over the past year. And thinking about that, what is it and how and what do you think geospatial science has guided the COVID response? We'll start with Este and thinking about how has Esri guided the response to COVID-19 using its geospatial tools and technology?
It's a great question. And I think the way that we approached it early on was to consider what do people need to do in response and try to simplify that, knowing that it's incredibly complex and nuanced and can potentially be long-term. So I came up with what I call the 5 steps for COVID-19 response, and it was map the cases, which we certainly saw with the Johns Hopkins University dashboard, and then the thousands of additional dashboards that were made because of that open data and that inspiration. Then it was about mapping the spread. So you have to add that temporal component to see where is it going, what is it starting to look like, when might I be affected in my community. The 3rd step was to map vulnerabilities. And vulnerabilities is kind of this broad term, and it's meant to be because we needed to look at vulnerabilities in our systems, but particularly populations that might be more vulnerable to severe disease or for other consequences related to COVID, like students vulnerable to not being able to do online learning because they're in the digital divide, they don't have broadband available in their neighborhood. The 4th step was to map capacity. And that really is about infrastructure. And really, in this case, early on, it was focused on hospital capacity, right? Are there enough ventilators? Are there enough hospital beds and ICU beds? When might we hit the peak of the curve? How long is that going to last? So geography and modeling was critical to understanding infrastructure. And at the same time, planning what is our expansion plan? How do we extend healthcare services when the hospital's overwhelmed? How do we extend services for testing and for vaccination? It's all part of the same repeatable problem. And then the last one is communicate with maps. I think that step was really essential to sharing public information. How can people better understand what this looks like for them in their neighborhood, in the neighborhoods where their family members live, and help guide decisions regarding travel and going different places, whether it's to work or other kinds of normal activities that then had to be reconsidered. So that was how we approached it in the beginning. And of course, it's expanded since then.
Absolutely. So, you know, when we think of a software company in a traditional sense, you don't think of them, I think as Esri solving lots more problems than what we think. What you just listed is far bigger than what we anticipate traditionally a software company would do. And maybe I'm not understanding what other software companies are doing, but I feel like this is Esri's situated in a way that is very different in that it collaborates well internationally with our local public health departments, our state and our CDC. So can you tell me a little bit more about that?
Yes, and I certainly can't speak for any other vendors. I only work for Esri, but I do think that we have a special approach and a special culture. We want to partner with organizations. We don't want to be the vendor that just comes in and gives you what you need and goes away. we want to help you through the process. And one of the ways that Esri is able to do that is they very intentionally hire subject matter experts across the many fields that we support. It's not, of course, just health, but we support, utilities and all sorts of different government departments, and we support commercial businesses. And so it's really very broad-based, and I think that helps us to be a trusted advisor and a partner to all of those organizations that have some need of geospatial information or would like to do something with GIS or location intelligence. We're there to help them. Maybe we have a little additional expertise with the way we do our hiring and promote our culture.
Great, thank you. So Dr. Garza, as heading up the St. Louis Metropolitan Pandemic Task Force, what kind of data or what kind of geospatial science did you all use to help drive the COVID-19 response? Were there ways and times where you thought this needs a different lens, or this needs an additional lens of geospatial health?
Yeah, thanks, Enbal, and thanks for having me on. So let me give you a little bit of history as well. So this week actually marks the 1-year anniversary of our pandemic task force. And so I don't count on there being a second anniversary. So this will be the only one that we have. But I think back to so one of the things that we did was we did a lot of communication with the public. And a lot of that we wanted to use geospatial information, because a map conveys a lot of more information than just purely throwing up numbers. And we still threw up numbers, but it was the maps part that I think really engaged the public. And so some of the things that we tried to focus on are exactly what Este said, is looking at where are the cases, where is it spreading, where are vulnerabilities, where is capacity. And so as some of you know, I come from a military background, and so we use the term, and I'm sure Este's understands this as well, as a common operating picture. Like, what do I need to have on my outlay to understand the complete picture of the battle space, right? And you have to have all of those different components on there. So some of the things that we would use to convey to the public are, hey, these are where the cases are going up. And so we could drill down to a very finite level, like a zip code level, and say, hey, every week we would show these are where the hot spots are. And it was merely for information. As time went on, we started adapting more things, like this is where admissions are coming from, and this is where other things were coming from. But it also gave us an opportunity to dig a little bit deeper. So as Este mentioned, then taking a look at, okay, so why are the cases going up there? What is the population that lives underneath there? Is it socioeconomically disadvantaged? Is it high poverty levels? Is it population density? Is it people that have to travel a far distance to get to work? And Enbal, you and I did some work on that. And that really tells you the story, rather than, hey, it's just the zip code. Well, it's not just that zip code. It is the activity that occurs within the zip code. It's the culture that's within the zip code. It is, how they go about living their lives that helps you understand what really drives the pandemic, rather than just saying, well, it's just isolated to this part of the county, which is very easy to do in the public unless you explain all of the information underneath there. And so having the ability to explain, this is the why behind what we're seeing, and then being able to use that information as well to help drive either your response to the pandemic from a healthcare systems point of view, or also inform policymakers as well about, this is what should be our, what we believe our approach should be, given all of the data that we're seeing. Incredibly powerful tool to really get down to, these are some of the root causes, these are the things that we need to address, and being able to communicate that to the public.
Absolutely, yeah. I think one of the things I just think of as a follow-up to both of you is, what are some of the things that we've been able to answer through geospatial health, combining the two, that were, we understand where COVID cases were being reported. We had dashboards, but what are the neat things that you might have seen being used that we hadn't used before? Can you think of any?
Sure. There's a laundry list, I guess, but I would say we saw Cobb County, Georgia. I'll give them a shout out here. They had this early application, if you all remember the run on toilet paper and other staples. They had a community application where people could monitor and make commentary on grocery store inventory. So you would know, hey, does the local store have eggs or bread or toilet paper? And it saved people some time and inconvenience, because I remember people traveling to 6 different stores or, hours at a time to try and find those necessities, which, sometimes didn't make a lot of sense, but good that people are trying to prepare. That was a cool one. But I would say that technologically, one of the things that has been really interesting was the human movement data and modeling human movement and understanding, you put a policy in place about social distancing. Are people doing it? What has the change been? And how does that get impacted by other things? Like, we saw significant differences in social distancing when the weather got warmer. People didn't care about it anymore. They went to the beach. And you can see that geospatially. So that was really interesting. We saw early on that people were frequenting home improvement stores. If they were going to be at home, they were going to make it nicer, whether it's lawn and garden materials or interior redesign, I don't know, but we could monitor those things with that human movement data. So that was really interesting. And just so everybody knows, it's always aggregated and anonymized. So we're not tracking individuals, we're looking at groups of people and behaviors. That was cool. And then I think other things that we've done that were a little bit of a surprise, or that organizations have done, I should say, is managing the vaccine supply chain. So a little bit of Internet of Things, looking at the monitors and the sensors on the different cartons of vaccine that look at, are they maintaining that ultra cold storage need, and then monitoring the inventory in real time with, just using your phone to scan the 2D barcodes and figuring out, is it going from, delivery to ultra cold storage, then does it move to refrigeration and then to ready for use? Because each time you do that, the expiration of that vaccine changes. And so this was a really good way to decrease waste by constantly monitoring. And then the last one I'll mention that I thought was cool, maybe two, we're starting to see right now a lot of folks doing planning for outreach to homebound individuals to make sure that they get vaccinated. Certainly a geospatial problem to be efficient about routing and territories and minimizing the number of people, since there's always limited capacity to go and do that. And then one thing that I'm kind of proud of is I got vaccinated crowdsourced story maps, so that we can build vaccine confidence by showing that other people like me or in my geography community have been vaccinated and they're doing fine. So it's an opportunity to share a selfie, and how long did you have to wait? What was the experience like? And I can put that that link somewhere, or we can share it, but that's kind of a fun and humanizing use of technology, just where people can share their story.
Absolutely. That's a fun laundry list. I really liked it. Alex, do you have any that you want to add?
Yeah, I'll just add a couple, and it's sort of along the same vein as what Este was talking about. So I remember early on, well, early on is a relative term in the pandemic, but it was on the Memorial Day weekend. So the Missouri area became national news because of the flock of people that went down to the Lake of the Ozarks, right? That were not wearing masks and not doing any social distancing and gathering in crowds and things like that. And so the obvious question was, well, so most of those people don't live at Lake of the Ozarks. They go there for vacation. So where do they come from? And so by looking at travel patterns, then we were able to see, okay, this is where those people come from, and this is where they're going back to. So then we can sort of estimate what do we think the impact is going to be on our community from this gathering of lots of people from lots of different places. And as we've learned throughout the pandemic, that's a recipe for transmission. And then suddenly coming back to these different areas of the state. And so we were able to take a look at that data and understand what we believe was going to be the impact of people going to those destinations. The other one was trying to get an understanding on some of the preventative measures that were being instituted around the region. And so as many regions are, there are different political jurisdictions, and there's different approaches to the pandemic. One of the things that was so frustrating about the pandemic is that it's really dependent upon the local elected official if the state is not taking a very proactive state or very proactive measures. And so we had this sort of quilt work of mitigation strategies. And so trying to understand something as simple as a mandatory mask mandate, or shutting down of restaurants and bars, or shutting down the venue size. How does that really impact? So people tend to think that, well, nobody moves beyond county, so obviously we should be able to measure the impact of the mitigation strategy within the borders on case rates or fatalities or hospitalization. And so we started looking at, well, where do people go once restrictions are put in place? And it turns out that they will move outside of the area where the restrictions are to go to a less restrictive area, whether it's to go to a bar or to a restaurant, and then they come back to the area where the restrictions are. And so essentially what you see a blunting of some of those public health measures. And so it's very frustrating when people sort of do this one-to-one sort of logic, like, well, this area had a mask mandate and this one didn't, and their rates were not that much different than this one, but that's not true. There's a blending. So being able to understand what that meant by looking at travel data was very important. And then the last one I'll throw out there, which really has come up recently, is there is huge demand within the urban area of St. Louis for vaccine. It completely outstrips supply. And which was exactly opposite of the rural areas. And so what we found is that people were traveling long distances from the St. Louis metropolitan area out into the rural areas where there was abundance of vaccine in order to receive vaccination. And so you can look at a map and you can understand these are the areas where people are traveling to get vaccine versus areas where there isn't any travel because there's abundance of vaccine there. And that really tells you how much pent-up demand there was for vaccine and how little supply there was to meet that demand within the geographic area. So those are three cases that I think illustrate really the power of looking at geospatial data.
Yeah. So when we think about those data points, I mean, I think several of those were related to mobility, so human mobility and how people move within their communities, beyond their county borders or their zip codes, and better understanding just the patterns of life, where we live, work, and play. And so that is I want to know what you all think about what should we be taking forward and promoting as an important avenue of research and practice that we need to know more about in geospatial health, in how we can implement different systems of knowledge. How do we provide better, more comprehensive care in your perspectives? Alex,
Sure.
you want to go ahead?
Yeah. No, so I think you're absolutely right about that, and just purely focusing on the data for people that have to travel as well. So certainly that was a reflection of some other socioeconomic issues. So people that don't have a car or can't take off work to go and get vaccinated, that impacts different populations as well. And so my takeaway from the pandemic and using a lot of this technology and data is what I think comes as no surprise to anybody, which the pandemic, like a lot of healthcare issues, is very complex. It is not just a single set of data. It's not just all about, gosh, if I just had a clinic or a hospital in this geographic area, all of my healthcare problems would go away. That's absolutely not true. The combination of personal risk issues, of economic issues, of living condition issues, of you name it, that can be multiple layered now on top of geographic data gives you a more complete picture on causes for poor outcomes or what drives pandemics or what other issues there are. I mean, you could throw crime in there. You could throw a lot of different things in there to understand it's not just about a crime happens in this zip code. It is about all of these other things that are occurring within the zip code as well. And so it gives you a little bit better understanding of the complexity and understanding some of the more root causes that you have to address rather than just the outcome. That's what I think is the big takeaway from this.
I guess if I were to respond to this, the one thing that I want to get across, and I always have a little difficulty with this, considering that I work for Esri, but as I preface this, I want to say that I came to work for Esri because of my belief in this. I didn't develop a belief in this because I work for Esri. So just so everybody has that straight, because I'm going to be really serious here in saying that GIS cannot be just a tool to make a map on occasion. It needs to be front and center as a part of all of these processes. We all have to learn how to think spatially. When you think about healthcare and public health, I mean, these patterns are repeatable. It's the same kind of thing. You can understand the different vulnerabilities in your population, the social determinants of health, or vulnerabilities for other reasons. You can start to align your resources to what that population needs. You can improve the operations of your system by aligning the services that you have to those population needs, by monitoring access to your services, by making better decisions. You can connect patients with clinical trials that are nearby. You can use indoor GIS to decrease infection rates. It needs to be a central tool for our infectious response and frankly for lots of other use cases, and we can talk about that in another question, but I just really want to make the point that it is time for GIS to come out of the back room. We've always been that support, in a dark room with our computers, providing a map when someone needs it. It needs to be the focus, at least a focus. It has to be part of many workflows connected to systems and fully integrated to bring the most value. And I hope that the pandemic has shown us some of that value.
I wholeheartedly agree. So I was nodding away. Yeah, I think one of our challenges, I think the pandemic has shown us lots of our challenges, right? The COVID infection in and of itself has shown inequity in the most efficient of manners. And so what we can do and see through mobility data, through case rates, through all and more mortality data, we can see everything in between that says, oh my goodness, we have these structural inequities that need to be addressed, and let us help figure out where and how to best create policies that can create change. One challenge with that, though, is I think we also saw the disconnectedness or the lack of data. We keep having different conversations in media where they're excited about herd immunity, or this week it's the vaccine passport. And so I keep pushing back to the idea of where are the data that you all think we have, right? Mm-hmm. I think the general public thinks that there are these data sets that are rich and connected and collected that are served to collect information that is what we need to make better decisions. Can you guys speak to that, both from the healthcare and larger systems thinking, Este?
Yeah, so certainly what you said is true. Disparities have been magnified. I think they always are in a crisis. and not only the individual human disparities, but also in a sense, system disparities or system failings. They all become really clear in a crisis, which means it's a great time to work to correct them. So I'm glad that so many people are. You know, I think it is a real problem. There's, even with the vaccination, there's a reluctance by about 50% of vaccine venues to collect the data on race, ethnicity, and age. You know, if you're not getting vaccinated through your healthcare system where they have that information, then you might not have it counted. And then so how can we answer the question whether or not we're equitably distributing vaccine? We cannot. And so, I mean, the Esri approach to this, to some extent, is that we can make mobile and on-the-fly data collection really easy, or we can connect to those systems that do have data. But I think there's sort of this bigger issue of trust. You know, what are people going to do with the data? How is it used? How does it benefit me as an individual? Will you treat my data responsibly? And then on the data collector point of view, you have to, I think, believe in the good that you're doing by collecting the data and not be so hesitant about it. We need to do good with data and we need to protect it, but trust building is certainly a process. And I think part of that process begins with transparency. And if you can be seen as an organization that shares that data back to the public, I think that will grow. So it's definitely a bigger issue, but it's such an important one.
Yeah, I'll throw a couple of things out there as well, Enbal. So I think one of them that needs to be highlighted as well, and this is some work I was doing with the Consumer Technology Association, is that public health has been severely underfunded for years, and that includes information systems. So when the pandemic first began about a year ago, I recall having discussions with our public health partners, and I thought they were going to break down and cry, really, because of the inability to share data back and forth with the state and with other partners. It was still occurring by fax and by phone numbers and all of these crazy things that in the midst of a pandemic are really unforgivable, right? And so in some ways, it was good and bad. It was bad because it was in a pandemic, but it was good because it shone a light on the problem. And then all of a sudden funding was appropriated so that they could get it fixed, right? And the same thing is occurring right now with our vaccine registries. If you cannot get, I think, Este, you were leading to this, if you can't get good data into your vaccine registry, then it's really difficult to see, okay, where am I missing vulnerable populations? What is the impact of vaccine equity on race and all of these other things? If that race cell is blank, then it's really hard to understand what is occurring out in time and space. The second one is and again, I'll refer back to these multiple jurisdictions. Being able to share data across jurisdictions can sometimes be very challenging, as well as sharing healthcare data with multiple different partners, because we're inhibited by some legal issues about sharing specific data, and so that makes it very difficult as well. But I do share the notion as well that there are still there are people that are concerned about data being used in the wrong way, or a big brother approach or something like that. So there's some cultural barriers that need to be overcome through education. There's some legal barriers that I think need to have another look at them for sharing data. But there also has to be an investment in public health data infrastructure that absolutely needs to occur.
Excellent. I love that. What to transition into, what skills or do you think that you've also highlighted through the pandemic has said, oh, we need better skills and training for these areas? We are professionals, whether they're public health, healthcare, or even GIS professionals. What are the things we need to do to train people to be better, both spatial thinkers, but really thinking about how do we develop more comprehensive responses?
I think it's a tricky area in the sense that people who know the ArcGIS know that there's a lot there. There are many tools, and if you're thinking about adopting GIS, it might seem overwhelming. Like, how am I ever going to learn all of this? How many people am I going to have to hire to make this useful? And so I, in some ways, agree with that there is a lot there. At the same time, I kind of live a lot by the 80-20 rule. And we've found that for a number of jurisdictions around the world, actually, there have been like 3 WebGIS tools that have consistently supported all sorts of applications, and all 3 are really easy to use. Like, literally, you could probably learn to use them in 2 or 3 hours. And that is ArcGIS dashboards. We've seen measuring metrics, monitoring progress, part of your operating picture, your situational awareness viewer. So learning ArcGIS dashboards is really easy. Survey 123 for mobile data collection is a really good skill. And then ArcGIS Hub is having that really configurable website where you can put your information, your interactive maps, but also your charts and other forms of data and narrative and videos and things that really describe a more comprehensive story. Those 3 tools alone, I think, could get people 80% of the way into really effective response. And those are easy to learn. So yes, I think there's this range of skills, but I think you could start with like high value, low effort, and move your way toward some of the high value, high effort skills, like learning some of the analytics and the spatial statistics.
That's helpful.
Yeah, I'll just make one other point, Enbal, and that is, at the end of the day, and this isn't just specific to GIS, I've talked about this with some of our quality improvement software and things like that. It's a tool, right? You still need to have that person who's able to use the tool to maximize it for the most benefit, right? So, and I think this is a perfect example of marrying up a really great tool with healthcare and public health, right? But you need that public health person or that healthcare person in order to really drive the tool to get maximum benefit. So it's not that you need expert in mapping software, right? You need to be able to understand what is going on out in the community, and then being able to translate that into, this is what I need to find out now. How can I use this tool to figure this piece out? And so oftentimes I think people get really excited about the tool, but you have to understand it's the person that uses the tool, not the other way around, right?
Yes, thank you for that, Alex.
Yeah.
I think that's so important. We have, I mean, people see a cool map, you want to make a cool map, but it's to answer an important question. And so
exactly.
I think that's actually a perfect, I didn't prep you for this one. So one of the pieces would be really think, what are we made some mistakes. We continue to make mistakes in COVID. We're not done with COVID-19. COVID-19 is not done with us in the United States or throughout the world. And we're racing with vaccine and versus variants, right? And so what we're finding out is that we made some significant mistakes that were, we had the picture of the maps. We had the maps up and we said, here are the maps, here's the infection, but here are the policies. And what ideas do you have based on those types of mistakes or other mistakes that you have seen that you wish we can tweak and prepare for the future? Is that too much?
Yeah, well, let me try and boil it down then, Enbal. And so I'm going to pull this back, relate this back to what I said earlier about investment in public health infrastructure. And so Este, I think most of the public health people know, as well as I think most of the GIS people know, surveillance is a big part of public health, right? And so being able to have a robust and actionable surveillance is really, really important, not just here locally, but globally, right? So you're able to identify outbreaks very rapidly. And part of that involves that data side, so being able to collect the data, and then part of that is being able to translate that into different tools, such as GIS tools. And so that, to me, again, I'm going to relate this back to investment in public health. I think we were caught in the pandemic, maybe not caught, but we were certainly not as prepared as we needed to be because of this underinvestment. Whereas I think we could have acted a lot faster, made decisions much quicker if we were able to have that data piece first, and then being able to then leverage those tools like GIS tools in the early parts of the pandemic. And then also being able to apply those to different non-pharmaceutical interventions, such as mask wearing or social distancing, and then looking at temporal patterns on that. Those would be huge investments. And I'm hopeful that one of the things that we'll take away from this is that we do need to invest in these apparatus to prevent, a needless loss of life in any future pandemic.
I guess I'm going to respond by saying something controversial. So hopefully nobody will beat me up for this. But I've had this view into a couple of different worlds as we've gone through the pandemic. And I've come to realize that, there's like public safety and police, fire, EMS, and there's public health. And all of these are really important in response to emergencies, including pandemic. And they're very, very different mindsets. Public safety mindset is like action, move, solve it, don't worry about things, just move, execute. And public health is, well, let's plan it. Let's analyze it. Let's think a lot about it. Let's check all the boxes, make sure nobody gets hurt. Did we include every vulnerable population? Did we do this? And then, you're into it really far before you've done anything. And so I don't know what the balance is, but I think when you are in a crisis, there's got to be some sort of a mental shift that leans a little bit more toward action and loosen some of the restrictions. I'll give you one really good example, again, being controversial, but I kind of figured out early on that the phasing that we did with initially phase 1, 2, 3, then phase 1A, 1B, 1C, 2A, 2B, anyway, the phasing is a problem. And I know the intent was good, and I know people aren't going to reverse the phasing because it has a focus on equity. And yet, if you look at the analysis, it is actually decreasing equity by taking so much time and being so cumbersome. And what you end up with, I've sort of likened this to innovation uptake curve. So you see like the early adopters and, then you get towards the laggards and the ones who aren't going to do it till everybody else has done it. When you have phasing, you have to go through that process every time, and you don't know where the laggards start. So what you do is you get a rush on vaccine for the next phase and it slows down, and you're twiddling your thumbs, waiting for people to come to your clinics. And those are the vaccine hesitant and the people who don't want to be vaccinated group. They need different kind of outreach. But you go through that every single phase instead of doing it all at once. And I understand there are limitations with the availability of vaccine, but that's really a scheduling problem. And we did not do a very good job as probably a global community in figuring out how to schedule these massive vaccination clinics. But my overall point, without going into too many more examples, is public health in a crisis needs to take, I think, a more action-oriented stance.
I don't think that that's so controversial. Don't worry.
You don't think so?
I know people do, but you're in the right place. We have a good question that I wanted to make sure, we have a couple good questions, sorry, I wanted to make sure to include them. So first we're going to go to Andy Deering asked, how do you see the geospatial systems that were established for pandemic response evolve to support or integrate better in healthcare operations and public health application in a post-pandemic world when we get there? How are we going to use these tools and systems?
Yeah, no, that's a great question, Enbal, and it's one that I've been thinking about here lately. So especially as you know, I do believe we're getting closer and closer to the end of the pandemic, and so then it's okay. So what do we do with all the stuff that we've learned, right? And it's amazing what you can do when everybody rallies around a common thing, right? And so now what do we do with that? So I do think that we can start then using the same things that we learned and the same tools that we used to figure out how to combat the virus, to combat other things. And so one that jumps to mind is personal violence, to be honest, because I think there is a lot of social and cultural and other sorts of aspects that you could use geospatial to understand more of what drives crime in one area versus another, and then being able to address some of those root causes. And when I say crime, so I work for a Catholic healthcare system. We have an academic facility in the city that's a level 1 trauma center. We have a pediatric level 1 trauma center, and early on in the pandemic, violence went down. I mean, there was not as many homicides and shootings. Later on, it became just devastating, right? And there are reasons behind all of those. It's not that a person just wakes up one day and says they want to go shoot somebody. And so trying to get a better understanding of what drives trauma within the city and within the county, so it's not just within the city, I think will give us a better idea on what are the things that we need to address. And you could pick that apart from any sort of disease process, whether it's diabetes because of overweight or not having access to fresh foods and things like that. But trying to use that to address very discrete issues within healthcare. And then in addition to all those other operational sorts of things, like where do I put a clinic, or things like that are all very important as well.
Yeah, I'm thinking about Este's comment about spatial thinking to solve problems too. And so how is it, you're in a really unique position. Not many healthcare systems have this type of position where you are charged with community health that is beyond the borders of your healthcare delivery systems. And so
right.
We're asking you to do a lot, and we want
no pressure, right?
But I mean, I think you need, these are those examples. I mean, just the example of crime and experiences in crime is a great one that says that's not traditionally been in the healthcare bucket. You've been responding to the examples and experiences of violence, but really, how do we get to the point where you move forward and you are in communities and understanding these systems that we've really uncovered easily, that we knew before, but now we really know, that can share how to do this better. How do we get some of the spatial understanding that says this is what it's like to live and experience life here, that drives me to where crime happens and how crime happens.
Mm-hmm. Right, exactly.
I don't know how you're going to do it, but but I'm happy to think about it with you. How about that?
All right, sounds good.
Good. Este, what did you think about the idea of these public health applications or healthcare operations in the post-pandemic world?
Yeah, I think for us, I mean, the patterns are the same. You have to do things like understand the situation that you're dealing with. You need to understand vulnerable populations, however they're defined by the thing that you're looking at. If you're looking at cancer screening rates, your vulnerable population may be your most rural populations who can't get to a screening site. So that the map, the spatial result of that is going to be different based on what it is that you're trying to tackle. Then there is, how do you make resource allocation decisions given what you've learned about gaps or disparities or poor health outcomes? How do you connect people with the resources to which they are entitled or they need? These are all geographic problems, but they are for every single problem, whether you're talking about homelessness or cancer care or rare diseases or some of the operational aspects of your health system or your public health department. It's all the same, but people have found these interesting and unique ways to ask the question or use geospatial technology to really help them get to the next level and create value and improve those health outcomes. So I see it as kind of, and I know, again, you're going to think it's my bias, but it's more my training, that it's like applicable to everything because everything happens somewhere.
Everything happens somewhere. That's awesome. I'm going to ask this one other question. I think this is probably our last question. With the President's National Infrastructure Program, including a substantial investment in 5G and internet access, along with a dramatic increase in telemedicine during the pandemic, how do these trends integrate with and trends that you both described in today's panel? So Dick Fleming poses, data security, data access, and 5G access, internet access. So what do you think? I think to Alex, I'm going to pose this to you first because you talked about how we need to change some legal understanding of how to share data, but this is an extension of that.
Yeah, I think somewhat. I think the other big piece of that, though, is exactly what they're talking about: investment in infrastructure. And so, as even though we're more familiar with the urban issues regarding access, and many of those are driven from socioeconomic issues, right? So, kids not performing well at school because they don't have access to broadband internet, things like that. But I don't think it would be. Well, we would be remiss if we didn't also include our rural partners as well, who continue to have lack of access to broadband internet. And so using that infrastructure I believe, will only help to improve both the interaction between those different areas, but also providing data as well. To what is going on out in these different areas, whether it's the rural or the urban underserved. And then the 5G, of course, increases speed and all those other things, and so you're able to get speed to data, to action that much faster. But I do think it's that ability to offer access that then opens you up to a better understanding of what is going on out in those communities if they have the ability to use broadband. As well as, and I forgot to mention this, but access to telemedicine as well, which the questioner is absolutely right. We blew through our strategic plan in telemedicine in like 3 weeks, what we thought was going to take us 5 years, right? And so who does that benefit the most? It benefits the most the rural areas, where most of the rural hospitals and clinics have been shut down. They don't have access to specialized medicine. That's who it benefits. And so that is absolutely, I think, a benefit to developing the infrastructure.
Awesome. Este, what do you think? Should we be concerned about data security or other intelligence concerns?
Well, the answer is yes, always. We have to be concerned.
Beyond what our current standard level is, I guess.
Well, I think that technology, both for good and for nefarious intent, will always evolve. So I think we all always have to be looking to the future and securing our platforms and taking care. I personally am not extremely conservative about my own personal information. I take proper care, but I'm not really steadfast about it. I think there's a balance. But if you're a health organization, you have to really protect your data or the data of your customers, patients. It's really important. And just to that, I wanted to mention, I put in the chat a link to our upcoming Health and Human Services Conference. Registration's complimentary, and we're going to be making a big announcement about security and health data. So it might be worth joining in. Just it'll be on the second day of the conference, so don't miss that part.
That is a perfect wrap up. Yes. So I first want to thank you both for taking the time and talking about geospatial health, and it's my favorite topic. So, and I get to talk to two of the leaders, so I really appreciate your time. It's been fun to think about, and I look forward to figuring out our next steps and in how we better connect communities with health and have better health outcomes. So everyone, thank you for joining us today. I would also like to remind you the next session of this National Speaker Series is hosted by T-Rex, Cortex, and GeoFutures. Is May 5th at 2 p.m. Central. The next speaker will be Will Cadell, the Chief Executive Officer at Spark Geo, and moderated by Tony Sardella, Vice Chair and founder of Evolve24. So please join us then. And until then, wear a mask, get vaccinated. Thank you. Take care.